Fireworks are spectacular to say the least, sometimes packing similar amounts of gunpowder to military-grade mortars. These consumer-grade fireworks are no joke. However, just as spectacular as the colorful explosions in the sky are the unfortunate traumatic injuries seen yearly in the United States, and they're on the rise. I'm Dr. Adam Goodcoff, and today we're talking about fireworks safety and the most common injuries seen in the ERs across the country each year. In 2020, the United States saw an uptick in injuries treated in the emergency department, along with, unfortunately, deaths. 18 individuals lost their lives to fireworks in 2020, which is undoubtedly sad. However, you might think that number is small. But how about those 15,000 patients treated in the emergency department? You might be surprised to hear that huge explosive mortars are not responsible for the majority of injuries. Nope. That title is left for firecrackers and sparklers, both of which can cause serious burns and even loss of fingers. When burn patients come in, the doctor's first job is stabilization. They focus on maintaining the airway, ensuring the patient is breathing all right and has circulation to all of their limbs. You may ask, how is breathing affected by burns? Well, here's two ways. First, we have the airway itself. In the setting of steam or hot smoke, patients can actually inhale this, burning their airway. While they may appear okay initially, the tissue begins to swell up and there can be life-threatening closure of the airway. As burn tissue settles, it initially swells. However, secondarily, it starts to contract down. You can imagine that in a finger, a burn all the way around could decrease flow to the finger, making it a vascular emergency. Now imagine a burn all the way around the chest. We call this a circumferential burn. At this point, if it begins to constrict down, the patient may no longer be able to breathe, expanding their chest wall out and in with each breath. In this case, an emergency procedure known as an escherotomy is performed. Basically, we have to cut down through the skin along certain tension lines to allow for the chest to expand again. Second-degree burns are the ones that require some treatment. Current guidelines actually just recommend topical antibiotic ointments, such as triple antibiotic ointment, composed of neomycin, bacitracin, and polymyxin B. At this point, you might think it's all doom and gloom. Well, burns are, but fireworks don't have to be. You can always choose to see fireworks in a safe venue set off by professionals. If you learned something in today's video, please give it a thumbs up and consider subscribing to have your health explained.